Well, welcome to this UK drug testing presentation. I'm Dr. Mike Garside, the Medical Director of Access Diagnostics, which is the parent company for UK Drug Testing. And in this video, we're just going to run you through some of the tips and advice on how to smoothly operate and procedurally run a workplace drug and alcohol screening program. So let's get straight into it. Well, let's get straight into what you do procedurally. And we've got some resources on the website which are going to help you out. The first one we're going to talk about is this downloadable screening form. This is a record form of the drug test you're about to undertake. It's in Microsoft Word format, which we hope you can all access, and it's editable, it's not locked. The design there is for you to fill this in with your own company details and the correct combination for the product that you've decided to purchase. Now, we've given you some examples to get started there, but they're not prescriptive. You will basically make that match the test that you're about to run. It has the person's name, any reference in terms of their employment record that you may want to put on there, and the data sample and test. List of medications is a vital element of this, and you want to ask them whether they've taken both prescription and over-the-counter medications, including all the common stuff like painkillers, hay fever treatments, or anything else that they may have consumed over the preceding at least 72 hours, ideally 1 to 2 weeks before you're running the test. Now, for most people, that's going to be pretty straightforward. They're not going to have taken too much. If somebody's on a big list of modern medications, then that can get a little complex. We're not going to go into the full details, but we're there to support you with cross-reactivity information against the product that you've purchased from us anytime during the working week. The donor statement is a critical element of this. And again, this refers to your company drug testing policy. Again, we can't be completely prescriptive about what your policy need be or what it will say. That is something that's written into your policy as a business or your employment contracts. But it's important that it refers to that and that the donor is aware of your drug testing policies and procedures. So do make sure that you've got something in place. Otherwise, if you're asking them to provide a sample, then it's purely at their discretion. And if it's not part of their employment contract and you have no policy, then again, it's a voluntary only basis for the sample to be given. Make these details match the test that you're using, and then you will see here that we've got 2 sections on this form. The assessor's interpretation, assuming that there's just one person undertaking the test procedure at any one time, but you'll also see a co-assessor's interpretation. Again, this is useful particularly in a non-negative result where you're looking for an independent third party to verify that that result is non-negative. You'll note that we are not referring to a test result as being positive for a drug. You must not do so in your procedures. These are rapid screening tests. Doesn't matter which brand, variety, or type of test you're about to undertake. If you are doing an on-site test as a rapid lateral flow test, then that is a screening procedure. It will perfectly accurately exclude all your negative results. But as soon as something comes up non-negative, that is the stage in an employment situation to move to a laboratory confirmation, which will differentiate the reason for that non-negative, particularly in relationship to prescribed medications. Okay, a little about offering the donor a selection of tests to pick from. Once you've determined the form's been filled in, you're ready to do your test, a good practical bit of guidance is to put 4 or 5 different identical tests onto the table or in the box and just say, pick a test. This avoids any allegation that the test could have been tampered with or that the result will be invalidated. The other best advice is these are cup tests in their original foils. All drug tests should come sealed in foils with all the CE certification on the front, as you can see here, unopened. And by giving them a test out of a packet, a manufacturer's original packet, again, any allegation of tampering goes out the window. When they're ready to do the test and they've selected one, obviously you can open it up then And in this example, again, it's important that you familiarise yourself with the test. Open it up for them and give them the element of the cup or the sample collection pack to go and do the sample into. Now, this is with a urine product. Obviously, it will have a minimum urine level for them to aim at. And then that should be given to the person once they've selected it from a selection of packs to go and perform the sample. Slightly different if you're using saliva, obviously that can be performed right there and then in front of you and with their cooperation. But with the urine, it's normal practice for them to go into a cubicle or a toilet facility to produce the sample. Key advice regarding that facility. If you can, make sure that there is dye in the toilet water, so that can't be immediately added to the sample cup. And in the cubicle, obviously, you want them to produce the sample for you, but you should probably go with them into the toilet area so that they don't have access to the hand washing facilities before handing back the cup. 2 practical points there. They're not taking the lid in with them quite often, so you've got a risk of spillage. And 2, it just means that the risk of dilution will be significantly reduced if you are taking the sample as they come out of the cubicle. So good practice points there in terms of securing the chain of custody and giving the best chance of the sample being a fresh body urine sample with no dilution or contamination. Now we're going to talk a little bit about reading the results, and the decision has to be taken whether you're going to display the results to the donor immediately or whether you're going to interpret those with yourself independently or with a co-assessor before relaying the results to the donor. Now, this is the results panel on this cup we're using as an example. Normally there will be an orange sticker obstructing direct view of the results. This is removed at the correct read time for the test, but does not necessarily have to be shown to the donor during the procedure of the test running. So you have the decision whether to reveal the panel as the results are developing and show and discuss the drug test results there and then with the donor, or to do that independently away from the donor. The choice is yours. There is best practice would say always have the results developing and showing in front of the donor in a continuous, if you like, procedure where they have selected their cup, gone into a cubicle to produce the sample, which is then handed to you. You then would bring them back into the test area and show them the results developing on the cup and sample that they have provided. That is the ideal scenario for a test procedure to be completed, and then the results recorded on the procedural form that we've already shown you here. Okay, so that gives you some guidance in terms of some of the pitfalls and best practices procedurally in running your drug testing sampling results, and the whole procedure should work seamlessly, easily. And the next stage really is only when you hit a non-negative result. And we've done multiple videos on the procedure that you should then move to confirm non-negative rapid on-site drug test results. So do follow the links in this video through to those next sections.